surgery, gynecology, okay, but cost effect is very more patients.
Okay, before I will take you to the Indian scenario, I'll ask Dr. Joe from Singapore to actually give some insight into it.
Okay, so I think the issue of cost is always first and foremost in every patient's mind. Okay, and it comes down at the end of the day. Put it this way: telling a patient that they can't have robotic surgery and they have to have an older form of surgery is like telling your child you cannot have a smartphone, you have to use an old Nokia phone that still uses 1G or 2G, the 2G network. Right? So we understand that the cost of technology over time will decrease significantly. And now more than ever in the evolution of robotic surgery, we are going to see the cost of robotic surgery drop drastically. Why? Because obviously there's market competition. So that's one factor. The other factor, of course, is how the robotic surgery is financed or charged by the hospital institution. So one of the things that we'll be discussing at this meeting is how to change the mindset of a hospital administrator in terms of how they charge for the robotic surgical service. So a key part of the robotic surgical service has always been that it's a premium service. So a premium is charged by the hospital to use it. But once the hospital realizes that this is actually not a premium service, but actually an efficiency tool to provide surgical service more efficiently, so patients don't have to wait as long to get their surgery, because you can do more surgeries in a day than traditional forms of surgery. And then it's an assistive technology that the hospital is using. Then, in terms of billing, in terms of costs, it becomes more rational. So we've published data as well over our 10-year experience, where the hospital bill size of open surgery, as Dr. Ruma pointed out, was the standard of care when we started our program and we converted to robotic. The hospital bill size for a robotic surgery actually ends up being lower than that of an open surgery because of hospital stay, because of medications needed, because of blood transfusions. A lot of other factors factor into the cost. So again, the idea of robotic surgery being expensive is, again, another misunderstanding along the lines of robotic surgery being done by a robot. So I think that mindset needs to change in the public, and I think that's where I think putting the word out is very, very key, what you guys are doing today.
When we are looking at the Indian scenario, any patient going through the open surgery, I think it takes time for the patient to recover. Patient is in the hospital for much longer time. If I give you an example of the gynecological cancers, say uterine cancer, the surgeries are more expensive. So as you know, the incision also is much more extensive. Most of the time, these patients start orally on day 2 or day 3. And we are able to discharge them around, say, day 5, 6, or maybe 7. IV fluids, antibiotics, looking at the recovery of the patient, I think patient starts moving on maybe day 2 of the surgery. So when you look at the overall cost, this I'm sharing my experience with you, and look at the cost of the robotic surgery. In robot-assisted surgery, in our experience of doing it in uterine cancers, exactly the same I think I'm giving you the example. They are taking breakfast the very next day morning and they are going home in the evening. Long incision complications are not there only. I remember the days because over the period of last 28 years, I can share my experience. Most of these patients are obese, they are diabetic, they have hypertension. And we used to do a lot of dressings on them that to let this, the incision heal. But all these things have gone away. In last 8 years, we have done, very obese patients, those who are having a lot of morbidities, and you feel so confident when you see your patient is going home the very next day evening. And I think their outcome, their quality of life is very good. Majority of the women, those who are working, they join their job in about, say, 10 to 14 days. So that's how, when you're looking at the overall cost of the surgery and comparing it with that of the open surgery, definitely the robotics actually supersedes. I think I don't think so that robotic surgery is costly at all.
You have to also see that across the country today, to begin with, they were only available in private corporate hospitals. It was an expensive piece of equipment. Aaj NIMS mein hai, just got installed in NIMS. So do you think how many people from different strata will get benefit? Right? I think Osmania is in the talk to happen. JIPMER has it, AIMS has it. There are so many, Tata Memorial Hospital has it. So these are all centers which are catering to people from all strata. So the benefit of technology should not be denied just for the cost. Although cost does get sorted out because of the overall, if you look at the larger picture. But even on the payment day, I think we will be able to give this technology to many more deserving women. And I think that deserves mention and discussion.
Hi ma'am. So here it is, you just spoke about the availability of equipment even in government setup. So like what is the number of trained gynecologists who are able to use it?
Yes, that's a very good question. We have limited number of gynecologists who were exposed to it and trained. And our endeavor of starting this association, this is 1 year old association. We started here in Hyderabad. We had one first meeting last year in August, where this is registered in Telangana for our pride. And last year, on 25th of May, we registered this body here. The biggest idea is to actually take along all the junior doctors, junior gynecologists who are coming up, train them well to be able to use this, because they will become the foot soldiers of our association, spread across the country and give the benefit to women everywhere. So that's the primary aim of this association, training and mentorship.
And also, like, how much time does it take? Because the equipment you showed looked a little complex. So
Okay.
I mean,
How much time you will take to get to know how to use the features of a smartphone? So learning the tool is not difficult, but using it safely on the patient requires training. That we must understand. Reliability or responsible deployment of people to use this technology is very important. That is where our role is. That is where we are taking it very seriously, to make sure the doctors who are coming to do this are well trained, credentialed by their hospitals, they have mentors, and they have other supporting staff to help them. So these are very, very, to build an ecosystem and a team for them to do their work. Very important.
Hello ma'am.